every day is Mental Health Awareness Day, is what I would say. And I think that the pandemic brought us many negative things, but a positive thing is that there is broad awareness amongst the public and in the House of Medicine of the importance of mental health and the reality that there is no health without mental health.
We're all human beings, and just as none of us are immune from physical health conditions, none of us are immune from mental health conditions. In fact, even the distinction between mental health and physical health is an artificial one. We're talking about health. We're talking about health for ourselves, for our families, and for the communities that we serve.
Mental health is medical health, and just as medical health should be a birthright, mental health should be a birthright.
With respect to cannabis, I think, cannabis use is, growing, and the number one most commonly cited reason for using cannabis is to alleviate stress, to cope with stress. And we know, certainly in, today's climate, we are dealing with, just being inundated with stress. And so there might be an increased drive for people to cope with that stress with cannabis. But I would urge people to probably look for other alternative strategies that do a similar sort of thing that might be a little bit healthier for you. Instead, we can look for ways to kind of help our mental health status by naturally augmenting the endocannabinoid system. So like things like, that can do this are like exercise, for instance, social interactions, just going out and kind of getting out of your general routine. A lot of these things, especially exercise, has been shown to increase endocannabinoids in the brain. So that could actually be a much more healthy and better strategy for sort of naturally augmenting your cannabinoid system as opposed to just coming and smoking THC, which is going to have a lot of off-target effects. So
we're at a very interesting and important point in time, I think, where there has been substantial destigmatization of mental disorders, but we still have a way to go. Encouraging people to be open about their conditions and their treatment is likely to play a strong and important role in further destigmatizing mental disorders, and is something we should all be encouraged to do.
I work in a pretty specialized segment of the field, though I still do have a few patients, and I practice outpatient psychotherapy, which I love to do. But keep learning, keep moving forward, keep fighting the fights where fights need to be had. Things like mental health parity. Making sure that people have as much access to psychiatric care as they do to physical health care.
If you have individuals that are concerned that they might have adult ADHD, bring them in the office, get them an evaluation. Missing a diagnosis for a patient with adult ADHD can have serious consequences. So if there are patients out there that are concerned they have adult ADHD, go see their practitioner.
I would just say I'm very grateful to have all the colleagues that I have in this field. I think that we do work that is very important and often underappreciated by our society and our healthcare system. And what I've noticed is the people that I work with have really sacrificed a lot to do this work, and I appreciate that, and I hope others do as well.
Depression and other mental health disorders are often chronic disorders. So we should not wait for a specialist to come in and treat it. And like other chronic disorders, the management and screening, diagnosis and treatment can start in primary care practices. And also not to take an approach that it's trial and error. So we tried a few things and nothing worked, and so give up on it, but just continuing to try again and again, because that's the best science that we have is around trial and error approach. But
just be aware that OCD, body dysmorphic disorder, the other disorders in the obsessive compulsive spectrum, excoriation disorder, trichotillomania are pretty common. They are more common than most people think, and they're usually under-recognized in clinical practice and go undiagnosed. So it's really important to screen for these disorders in clinical practice.
What we want to tell people in the community is that if those patients are drinking and they have end-stage liver disease, it does not rule them out for transplant evaluation. And in a program like ours, where we're geared toward working with them even while they're drinking, including using anti-craving medications or other experimental medicines to help them reduce their drinking. And these psychotherapy programs, along with these different strategies, really, it's giving them a chance to get back on track and hopefully get a transplant if they need it, and to survive and do well in the future.
So I get asked about psychedelics, the availability of psychedelics. Can I get into a study? Can I go get psychedelic treatments by patients all the time? And I think psychiatric practitioners and mental health clinicians in general are getting an increasing number of questions and would-be solicitations about this. And it really is a challenge, because all psychedelics, or all classic psychedelics at least, and MDMA as well, remain Schedule I drugs. So they're illegal outside of a research setting, at least in the United States. And yet, savvy patients can certainly get a hold of these things if they need to. And so there's there's a tension between intensifying interest in seeking out these things, and there's not any sort of safe above ground way to do that. And so I think that the question is, how to approach patient questions on this. And I actually would refer people to the APA's. There's two different statements about psychedelics, and one of them, I think it's the one that was published in 2022, has a really thoughtful discussion of just how to talk to patients who are interested in psychedelics about them, and how to both safely institute harm reduction. If it's a patient who is going to go out and get psychedelics, what can you do to at least assure that, to the best of your ability, that this would be safe and not lead to harms, or that they're not on a medication that would interact with it. But at the same time, absolutely not participating in any illegal activities and not encouraging illegal activities by patients either. So I think that the APA actually put out that document, and then another one in 2023, both of which I would recommend reading.
But really, what I would encourage colleagues is to get together and, as clinicians, to ask for more research, and as researchers, ask for more participation from clinicians, so that we all come together and try to work together to find better treatments and better ways to use currently available treatments.
It's easy to write off psychiatry and psychiatric distress, but in the end, the experience of all illnesses is through the brain, right? And it's us, and we're the ones who deal with the brain, so that nothing gets better if mental health doesn't get better. So for all the folks who are really in the trenches doing the work, keep doing what you do.